Hi, my name is Alexa Giammarino. I'm an internal medicine resident and incoming gastroenterology fellow. What I'm going to talk about today are social determinants of health and their impact on chronic liver disease. Let's first start out by defining social determinants of health. These are factors that affect one's health that are actually non-medical. You ask yourself, what does this have to do with chronic liver disease? There's been a lot of research on this topic. Studies show that those living in more deprived areas, identify as a minority, have lower education, and lack the means to adequate food, income, and transportation are at higher risk for liver disease. Some even have more severe liver disease. How can we close these gaps, and who can do so? We can all act to close the gaps. We need to acknowledge, educate, advocate, and listen. A great model that shows how social determinants of health start in a community, work their way through, and end up affecting chronic liver disease is over in the left-hand corner of my poster, the upstream-downstream model. Upstream, you see the root cause of social determinants of health. As it flows through the community in the midstream section, you can see differences and separation start to happen between different people. Downstream, you get to the larger differences in the access to liver transplantation, access to palliative care, mortality differences, differences in hospitalizations, and access to curative hepatocellular carcinoma therapy. There is a ton of research, and we need even more in this field. Some of the research and the highlights of this research are shown in the middle section of my poster. The most important part of social determinants of health are what we are doing to close these gaps. As of March 2023, the CDC now recommends HBV, that is hepatitis B virus, testing for all individuals 18 years and older at least once in their lifetime. Telemedicine now gives those without transportation a means to healthcare. There is creation of committees to spread awareness, such as the AASLD Inclusion and Diversity Committee, educating and listening to communities of minorities, establishment of African American Transplant Access Program and Hispanic Transplant Program at Northwestern has been a great step in the right direction. We can do even more to close these gaps and get everyone the health care that they need for their liver. Thank you.